Hi, welcome and thank you for joining our monthly webinar. Kendra and I are both dietitians with Sweet Pea, and today we're going to talk about dietary and herbal supplements. The supplement industry is a billion-dollar industry, and it's expected to grow at an annual rate of about 8.9% annually. And that's from 2022 to 2028, which means it'll be a $272 billion industry by 2028. This is due to the growing awareness to personal health and wellness. People are changing their eating habits. They're managing their stress and sleep patterns differently as we go through our chaotic lifestyles. And all of that drives the supplement industry. So today we want to make sure that you're well equipped with the understanding and the knowledge in order to make supplement use safe and to be a safe consumer of these products. So before we jump in, we're going to go through our agenda today. So we'll go through introductions so you can get to know us and our backgrounds. We'll briefly touch on what whole food plant-based eating is. Next, we'll give an overview of the prevalence of dietary supplement use. We'll define the different supplement types. Then we'll talk about how and who should supplement and how are they regulated, and we'll talk about third-party certification organizations to look for safe supplements usage and reading the label, and then lastly talk about considerations for taking supplements, and we'll provide you with our contact information so you can take a look at reach out to us if you have any questions. So our mission at Sweet Pea is to grow public awareness of the health benefits of plant-based nutrition and to provide tools and make a plant-based lifestyle attainable for everybody. In the time that we've established our organization, we've been able to touch and make a difference in hundreds of people's lives. Our vision is to cut chronic illnesses killing Americans in half. Out of the top 5 leading causes of death, 5 of those diseases are conditions that can be prevented and even some reversed through whole food plant-based eating. Our values: we do work sustainably. All of our kitchen scraps go right into the compost. We use Headwater Food Hub as one of our produce suppliers, and we work closely with Full Moon Farms Organic for seasonal produce along with other farmers. Our dietitians leave a 0 paper trail because everything that we do is done electronically. In our last value, we do value our people. That includes our customers, our vendors, and our employees, and we do that by doing the right thing. So I'm going to let Kendra introduce herself, and I'll introduce myself shortly after.
Hi, everyone. My name is Kendra Horn, and I'm a registered dietitian nutritionist and certified health education specialist. I completed my bachelor's degrees at Miami University of Ohio, where I studied dietetics and health studies. And I completed my master's degree at the University of Alabama, where I studied human nutrition. I've been an RD for 15 years. I have been with Sweet Pea for almost 2. I most recently became a certified intuitive eating counselor. So with Sweet Pea, besides teaching people about how to eat a whole food plant-based diet and what constitutes a healthy diet, I also help them to heal their relationship with food and let go of the diet mentality. I myself have been plant-based for 11 years. Prior to that, I was a lacto-ovo vegetarian. Started out in high school all the way into 11 years ago, early into my career. So I am happy to be here and to share with you all about our programs and about supplements.
Thanks, Kendra. And my name is Jen Nguyen. I'm Director of Nutrition at Sweet Pea Plant-Based Kitchen. I'm also a certified personal trainer. My specialty revolves around sports nutrition and plant-based eating. Prior to joining the Sweet Pea team, I was a school dietitian. I worked per diem as a clinical dietitian and worked at an athletic club providing nutrition counseling services to members. I completed my undergrad in nutrition and dietetics from Cal State Long Beach and my dietetic internship through Cornell University. To date, I've worked with hundreds of individuals through Sweet Pea to help them discover how movement, eating, and improving one's well-being can help them live a happier life. And my main reason, on top of doing it for health, is eating plant-based I know can do well for our environment, and that's my primary reason on top of doing it for health and to be an example for our clients. So let's take a quick look at this slide here. This slide shows the differences between the various vegetarian dietary patterns that we encounter most. In this chart, the main difference here is that whole food plant-based eating limits and avoids highly processed foods, including oils. Through Sweet Pea, we do encourage eating whole food plant-based for a variety of health benefits, disease prevention, and getting your nutrients naturally from foods. Here we see the list of foods that are included and excluded while on a whole food plant-based diet. By nature, we may be inclined to look at foods that are not included on this way of eating, but let's shift our focus so we can focus on the foods that we can have, because there's a lot more variety that's included versus excluded, and a lot more nutrients that you can get from fruits, vegetables, whole grains, nuts and seeds, legumes and beans, and minimally processed foods. These food groups that you see here contain a myriad of vitamins, minerals, and beyond that, phytochemicals that have been shown to reduce risk of certain types of cancers, prevention of nutrient-related diseases like heart disease, hypertension or stroke, diabetes, and chronic kidney disease. On the foods that we can have, you also see here that we have minimally processed foods such as plant-based milks, cereals, breads, pickles, fermented foods, and so on. These are foods and still in its original form and may be slightly altered for the main purpose of preservation, but does not substantially change the nutritional content of foods. And some of these foods may also be enriched or fortified with additional nutrients as well. So while there's no meat, dairy, seafood, or highly processed foods, think about all the nutrients that you can get from eating those food groups that you see here on the left-hand side. Supplementation is often misused in place of food, so I'll have Kendra jump on and kick us off in this topic that we're here to talk about today.
All right, so over 50% of adults in the United States use dietary supplements, and this is according to the CDC. The most common forms of dietary supplements that are used are going to be multivitamin mineral supplements, calcium and vitamin D, vitamin B12, vitamin C, omega-3 fatty acids, and herbal supplements. In 2016, the consumers in the US spent over $41 billion on supplements. So it's a very, very big industry and projected to grow, as Jen mentioned. There are lots of different types of supplements. Dietary supplements are products that we take by mouth that include a dietary ingredient. So things like vitamins and minerals and amino acids. Herbal supplements are supplements that are derived from plants, so any part of the plant or their oil. They've been used for centuries and a lot of times have medicinal type properties associated with them, but we'll talk about their safety here shortly. But common ones would be like St. John's wort and echinacea. There are also ergogenic or sport type supplements, and these are used to enhance exercise or athletic performance. So protein powders, creatine, branched chain amino acids, electrolytes. And this is really a big industry. In 2016, so that same year that we spent $41 billion, we spent $5.67 billion on sports type supplements alone. And the big thing to really take away from this whole talk is the regulation of supplements. So the FDA is the primary regulator of supplements, but it regulates them a little bit differently than you might realize. The FDA is really in charge of monitoring what's on a supplement label. But the FDA considers supplements to be food. So they don't treat it like they would a prescription medication. A prescription medication, as you hopefully know, has to undergo all sorts of testing and studies to prove that it's safe and effective. Whereas the FDA, because it considers supplements to be food, relies upon the supplement manufacturer to ensure that their product is safe. The FDA has good manufacturing processes in place that it wants the supplement manufacturer to utilize. And the FDA will occasionally inspect a supplement manufacturer's place of making their supplement. But there's no testing done ahead of time by the FDA to ensure that a product is safe. So that means if you were to walk into a store today and pick up a supplement off the shelf, besides the supplement manufacturer itself, no one has tested that supplement to make sure that it says that it actually contains what it says it contains. So very, very important that we ensure that our supplements are safe. And Jen's going to talk about that in a second. But the other government entity that helps to regulate supplements is the Federal Trade Commission, or the FTC. And their job is really to oversee how supplement manufacturers are advertising to consumers. So if you think about commercials and infomercials and things like that, that's what the FTC is regulating. And on a supplement label, supplement manufacturers can include lots of different claims. And the most common one is a structure function claim. And these describe the role of a nutrient or dietary ingredient intended to affect the normal structure or function of the human body. So these are examples here. Calcium builds strong bones, fiber maintains bowel regularity, antioxidants maintain cell integrity. But there's also claims about well-being, and there's claims about nutrient deficiency diseases. So like vitamin C and scurvy, they could put that, this product, this vitamin C supplement prevents scurvy, but then they also would have to include, well, how many people really get scurvy each year to make sure that it's clear to the consumer that there isn't some sort of scurvy epidemic, just as an example. But these claims, again, are not pre-approved by the FDA. So the supplement manufacturer can put a claim on their label, and within 30 days of that supplement hitting the store shelf, they have to report to the FDA what they put on their label. But again, nobody's making sure that it's accurate beforehand. So just really important to know that. And because there's no pre-approval, supplement manufacturers also have to include a disclaimer. And the disclaimer essentially says that any sort of claim that's on there has not been evaluated by the FDA. And because it's a food and not a medication per the FDA, they also have to say that they're not intended to diagnose, treat, cure, or prevent any disease. And Jen is going to tell us how to determine whether or not a supplement is safe, because I know that was kind of scary stuff we just talked about.
Thanks, Kendra. Yeah, so how do you determine whether a supplement is safe or not? So third-party certification is what we use, or third-party testing. A third-party certification is when the organization itself is not the supplement company who is verifying or certifying that the product is safe. In other words, the company that is testing is an independent company or a third-party organization. These companies that you see the logos of down here below will test to ensure that supplements contain what they say on the label, along with the safety of the supplement, which includes testing for heavy metals, bacteria, pesticides, or really anything harmful to the consumer. The two companies or three companies that you see here, so NSF and US Pharmacopoeia, or USP are nonprofit organizations, and then Consumer Labs is a for-profit organization. Nonetheless, all of these supplement companies that go through these companies for testing must provide their products to these companies, or they send in a request for the organization to test their products. And it does cost thousands of dollars to get one product tested. But if you see a logo or any of these logos on a dietary supplement, chances are that supplement doesn't contain any harmful substances and that it contains what it says on the label. Some important things to note is that these three companies will not test weight loss products, products with illegal ingredients or unsafe ingredients, ingredients that are not recognized for the FDA, or for, they won't test for ingredients that they don't have tests for. So think about that, and think about all the ingredients that you may find on a supplement bottle, and we'll talk more about what to look for in the ingredients section. So beyond testing individual supplements, manufacturers can have third-party organizations come into their facility to ensure a consistent quality process for their supply chain. This type of testing will validate the strength, the quality of the product, and the certification is a good manufacturing practice. You'll usually find this on the company's website under sourcing and processing. If you don't see it, I would encourage you to reach out to the manufacturer and find out if they do have the good manufacturing practice certification. Because as a consumer, you do want to know whatever it is that you're taking meets the quality standards, and that it's safe and effective. And more importantly, this also ensures that the next time that you purchase a dietary supplement, it's the same product and it's not tainted with any harmful substances. Third-party testing also does not certify organic or herbal supplements. And during this process, herbal supplements don't have a third-party verification. So the best tips that we have here to ensure that contamination is lowest is to buy organic, and that will ensure less pesticides on your on the herbal supplements. Also, making sure that the ingredients on the label are recognizable and that there are very little to no other ingredients listed on there, because the more ingredients that are listed on there, the more likely that it may have some sort of contamination. And then avoid proprietary blends. So proprietary blends listed on supplement labels will not allow for the consumer to understand what it is exactly that proprietary blend contains. So there could be filler ingredients, there could be harmful substances included in that proprietary blend. And then investigating and knowing where the herb or botanical comes from, where the company sources their ingredients from, is really important. And you can usually find that on the website. If they don't list it, I would be very wary of that and reach out to the supplement company or the herbal supplement company. And then lastly, making sure that you purchase from a large, well-known brand that will ensure that the company meets its quality and that they have quality standards that they need to meet. So let's talk about what's in a label. So in a label, a food or nutrition label, supplement labels are as equally important to know. Knowing what's in your supplement can put you at less risk for taking harmful supplements. And if you take a look at this gauge here, if you don't know what's in a label, you can be at very high risk for consuming harmful substances or dietary supplements that you really don't know what's going to do to your body long term. When you are taking zero supplements, you're at the lowest risk here. So let's talk about what's in a label. On a dietary supplement label or on a dietary supplement product, you may see that some dietary supplement products might have a supplement label and some products might even have a nutrition label. The differences between the two is that a food product that contains a nutrition label usually will have ingredients that are known to be safe and tested by the FDA. And those foods are listed under the generally regarded as safe list, and that's known as GRAS. A supplement label, on the other hand, if a product uses ingredients that are not on that GRAS list or doesn't contain safe quantities of ingredients to be determined to be safe, then they're usually classified as a supplement label in which they'll have a supplement facts. So on here, there are a lot of things to look at. Some key things that you want to note, first off is it a nutrition or a supplement label? Secondly, you want to look at the serving size that's recommended on the supplement label compared to maybe what your provider is recommending. Next, you want to also look at the percent daily value. And something to note is that this percent daily value is listed here for adults and children ages 4 and up, unless it's notified or mentioned on the dietary supplement that it's not. The other thing to note here is that On number 6, the vitamin, mineral, herb, botanical metabolites will all be listed here. And next to that would be the dosage that you'll find. And then of course the percent daily value. And then number 8, the asterisk that you see here is usually will indicate that the nutrient doesn't have a established percent daily value or RDA or recommended dietary allowance. So it's really important to know what's listed on here and that you understand what it means, because it's, as you can see on the percent daily value, it's very easy to consume over 100% of certain types of nutrients. And there are some nutrients that do have toxicity levels. And then lastly, the ingredients. So this is very important. Like a food label, you want to pay attention to ingredients, especially in supplements, because there are, just as an example on this one, there are a ton of different preservatives and chemicals that are added on here. So some things that you want to look for on a label. So sugar or artificial sweeteners, dyes or coloring listed on the ingredient label, hydrogenated oils, artificial flavors, lead, mercury, polychlorinated biphenyls or BCBs, magnesium silicate, which is an anti-caking agent used in deodorants, and then titanium dioxide, which is normally used in cosmetics. So these are just some ingredients to know and put on your list and put on your radar to look for when you're looking at the back of a supplement label. So let's shift gears and let's talk about who should take a dietary supplement. When looking at athletes, there are many athletes that actually do benefit from supplementation to improve their performance, decrease recovery time, and provide them with additional nutrients, especially if they're injured. These athletes, of course, should first hone in on their nutrition through food and then identify where those gaps might be missing through blood testing, and then supplement accordingly. There are also certain conditions that might warrant individuals to take dietary supplements. So in the clinical setting, when patients are ill, they might have a loss of appetite, or their bodies may not be capable of absorbing certain nutrients. They may require additional nutrients through supplementation. And we'll go through some of these specific conditions here. So for heart disease, physicians most often recommend fish oil. And then there are individuals who are also in a clinical setting who might be malnourished or may not be able to eat by mouth and may require tube feeds that are supplements or require additional supplement shakes if they're, again, malnourished. And then we have bariatric and patients who may have parts of their gastrointestinal tract removed. And those individuals will usually have lower rates of absorption, poor digestion of certain vitamins and minerals like thiamine, B12, your fat-soluble vitamins A, D, E, and K, iron, zinc, and copper. Individuals who are also prescribed long-term antibiotics might also consider taking a supplement because antibiotics can reduce your gut microbiome diversity. Therefore, that can potentially lead to an overgrowth of bad bacteria. It also may interfere with macronutrient metabolism and even cause antibiotic resistance. So some clinical uses of probiotics have been known to help decrease these adverse risks associated with antibiotics, but also know that there are specific strains that are recommended for these specific uses. And those, the use for those probiotics are primarily used for antibiotic-associated diarrhea, C. diff-associated diarrhea, or H. pylori infection. The probiotics that you see on the market, more is not good. So having more strains does not necessarily mean that it's a good thing. The research now shows that having too many strains of probiotics in your body is actually not beneficial because there are specific strains for specific purposes. And then For individuals who suffer with alcohol abuse, this is another reason for supplementation. A condition known as Wernicke-Korsakoff syndrome is a brain disorder caused by thiamine or B1 deficiency. Deficiency of thiamine can not only affect the brain, but it can also affect other parts of the nervous system, the cardiovascular system, and also the immune system. And then we're just going to touch on one last one, which is a more commonly condition known for bone loss, is osteoporosis. And people who develop osteoporosis may be predisposed genetically, they may be at risk due to age, and they might not be meeting their calcium, vitamin D, or vitamin K intake through food. So these individuals will often require supplementation. And these are, again, just to list a few. There are many conditions out there. And I'll let Kendra jump on now to talk about nutrients that we want to look for while eating whole food plant-based, and some other considerations to think about.
All right, so I think it's important that we first say that we want to get our nutrition from food first. I didn't mention, but I actually teach college courses. So one of the assignments for my nutrition students is to analyze their diet and see if it's adequate or not, and then discuss how they would fix it with their diet. And sometimes they'll write, well, I'll just take a multivitamin mineral supplement. And that really breaks my dietitian heart. And so I always tell them, no, like, we want to get it from food first. And that's because nutrition is a relatively young science. We were still discovering vitamins in the 30s and 40s. We still don't know what all is in food. Jen mentioned phytochemicals earlier in our talk. And we can't replicate the things that are in our food. We need to get it in food form first. So sometimes we want to consider taking a supplement to supplement what we're eating. On a whole food plant-based diet, one of the most common supplements that's going to be recommended is vitamin B12. And that's because, as Jen talked about, we remove animal-based sources in our diet, and animals are a primary source for vitamin B12 because that's because they have bacteria that live in their gut that produce vitamin B12. So when we eat animals or their products, we get vitamin B12. On a whole food plant-based diet, we can look for foods that are fortified with vitamin B12 in order to meet our source for B12. But sometimes it's nice to have a backup, and that can be a supplement form. Vitamin B12 can be found in plant-based milks. That'll be added to that. It'll be added to nutritional use, but a deficiency of vitamin B12, even among vegetarians, is pretty rare because our body is really good about recycling and reusing it, but it's always a good idea to take a small dose of vitamin B12 for healthy young individuals. Vitamin D is another supplement that we might consider, and not necessarily because of being on a whole food plant-based diet, but just because this is a really common nutrient that's deficient in Americans. And vitamin D is the sunshine vitamin, and if we live somewhere where we're not able to be out in the sunshine all year round, we probably would need to take a vitamin D supplement. But we find vitamin D on a whole food plant-based diet, again, in fortified plant-based milks. And also you can look at the nutrition facts panel of mushrooms and see if you can find one that contains vitamin D, because mushrooms that are exposed to ultraviolet light will make vitamin D just like we do. Omega-3 fatty acids are another common supplement on a whole food plant-based diet. Omega-3 fatty acids are primarily found in fish. They're a really healthy source of omega-3 fatty acids. But again, we've excluded fish from our diet. And so we might want to consider taking an omega-3 supplement. And so what we do is we actually take an algae oil supplement, which sounds really gross, but it's not. We jump over the fish and go straight to their source for omega-3 fatty acids. We do get some omega-3 fatty acids from walnuts and chia seeds and flax seeds, but the conversion of that type of omega-3 fatty acid to the more commonly known ones, DHA and EPA, is relatively small. So it can be useful to look for foods that are fortified with DHA and EPA, or think about an algae oil supplement. Calcium is another nutrient of concern. Again, not necessarily because of being on a whole food plant-based diet, but for females, especially who are at increased risk for osteoporosis, we want to make sure that we're including foods that are going to be high in calcium. fortified plant-based milks again, but also almonds and oranges and beans and leafy greens, calcium sets, tofu will also be a really good source of calcium. But thinking about maybe taking a supplement if needed. Iron is another supplement that we might consider on a whole food plant-based diet, especially for young women who are menstruating or children who are growing. We find iron in beans and nuts and seeds and leafy greens. But iron, vitamin D, vitamin B12, these are nutrients that we can actually have tested. So we can have our blood work done when we go to meet with our physician, and they can tell us if a supplement is necessary or not, and determine the amount that we would need by looking at our blood work. So we always want to consult with a provider before taking any sort of dietary or herbal supplement, including those ones for our workouts. Anytime you go to a healthcare provider, you always want to disclose what you're taking so that they know, so that we can prevent any sort of interactions between a prescription med and a dietary supplement. But even if you're not taking a prescription medication, you still want to disclose what you're taking when you go to see a provider. All right, so herbal supplements, even though they come from plants, can have adverse effects. So we want to be sure that before we take something, that there's been lots of research established that shows that it's safe and effective, and how much to take and how to use it.
Next, you want to make sure that you read the label and understand what you're taking. And we talked about the third-party certification and the testing that supplement companies can go through. So look for those stamps, read the website, investigate, and look at where these sources of the supplementation or the ingredients are coming from.
We want to look for appropriate dosage recommendations if we can do that via the Office of Dietary Supplements, because more is not always better. We can reach toxic levels with certain supplements. So we want to be sure that we know how much we really need. And again, this is key, where we can work with a healthcare provider to determine how much we need and how to take it in a safe way.
And lastly, as dietitians, we will always encourage and recommend a food first philosophy and supplement as required. So as Kendra mentioned, getting blood work done, talking to your provider to ensure that you are deficient, because the reality of it is it's very easy to overconsume in any type of nutrient. So you want to make sure that you are meeting just what you need so your body can function optimally. So this includes our presentation for today. We want to thank you for joining us. Here's our contact information if you need to reach out to us or have questions and would like to ask us any questions. Jen at sweetpeaplantbased.com. You can reach Kendra at sweetpeaplantbased.com. And here's our number. And you can, if you could follow us, we will love all the followers that we get. And we're, again, we thank you for your time and see you next time.
Thanks. Bye.